walker. Crutches, you saw crutches?
I just.
Oh, okay, but
used
as
it.
an example,
Yeah.
very good, very good, very good. What else? What else?
A cane?
Hmm?
A cane?
A cane, very good. We have single canes and we have tripods and quad canes, right? If we need a little extra stability, we'll see that. Huh?
Penny walkers.
Walkers were said,
No,
yeah.
penny walker. It's a different.
Yes, it's, but it's the same
Same
category.
family.
Like the white.
Yes.
And also in the hallways, there was, like holders, ramp. I mean,
Yes, rails.
ramps.
The rail.
Yeah,
Yes.
all the way.
That they also use, right, for stability and to
Yeah.
help propel them. Very good. And when we are positioning our patients in bed, okay, if they cannot turn by themselves, we will use positioning devices or assistive devices to help them maintain proper body alignment. So that's another way that we can work around any limitations that our patient has. What's another reason why it's important, do you think, to turn and position your patient every 2 hours in bed? Pressure ulcers, right? Skin integrity. Nurses are very, very fastidious about our patients' skin. We do a full skin assessment, and part of that is the turning and positioning every 2 hours. Very good, very good, awesome. All right, so now let's think about exercise on the heart. What does that do? What does exercise do for our heart? What's the benefit?
Improve blood pressure.
Have good circulation.
Good circulation, right? Improved blood flow, okay? Think about, we're gonna be coming up to Marathon Sunday next month, right? All of those wonderful hundreds and thousands of people that run so many miles and they practice all year. How do you think their heart is? Is it an efficient pump?
Yes.
Oh, yeah. Oh, yeah. Oh, yeah, I can't run a mile, forget about it. Not without having to stop, I'm sorry. But they can run, and boy do they run. And we used also the example, a couple of lectures ago with Michael Phelps in swimming, right? So what does that do for the heart? He swims 12 hours a day. Do you think he's got a good, efficient pump?
Yes.
Good. So what's his heart rate gonna be?
Low.
It's gonna be low. Why?
Because his heart is so strong.
Because the heart is so strong. Very good. See, good. I'm glad you guys are listening to me. Excellent. I'm loving it. Professor McDivitt, they're having their exam October 10th, so yes. And thoughts have turned to that. Yes. Okay. So what happens if we are immobile? What happens to our heart? Does our heart as a muscle become deconditioned?
Yes.
It can. It can. So what will we see in our patient?
Like blood clotting.
We might. We might. If it's an ineffective pump, if the output is low. Yes.
Irregular heartbeat.
If the heart rate is very low, it's a potential, yes.
High blood pressure.
Yes, yes. You also may see with some exercise an increased heart rate. Because if you don't do exercise, if you're more sedentary, and you start doing exercise, right? Any little activity, now your heart has to work harder. Okay, because it's not as efficient. It's not as efficient. And if it does, like you said, that could be a indication for potential blood clots, DVTs, strokes, right? So all of that we want to avoid. And what is the orthostatic hypotension? We just talked about that a few minutes ago.
When they're busy.
When they sit up, they're dizzy. Yes.
Blood pressure drops.
Yes, yes, very good. Okay. So, very important for our patients if they are on bed rest, you will see it most likely in your skilled facilities. You should definitely see this in 21 and moving forward when you go into the hospital setting. We have what we call a DDT, standing orders or prophylactic